I'm doing the best I can with the view of the camera, so I apologize. I have limited areas to put it. So I will say as much as I can, so if you can't see it, it's said. Hi, I'm Fluent Clinician Jennifer Ely. What's your name?
Adam.
Nice to meet you. Today we're going to be doing some tests and mobilization of your knee. If anything that I do hurts or if you have any concerns, please let me know. May I begin? Okay. So we're going to start with the soft and bony palpation. We'll start with the bony palpation. So you're going through, you're touching the patella, and then you're doing the medial tibial plateau. Oh, this is a horrible view. I'm so sorry. And then you are going to do the tibial tubercle, the medial femoral condyle, and remember I didn't say this for the medial tibial plateau, you need to externally rotate the foot so that you have access to it. And then for the lateral tibial plateau, you have to internally rotate the foot. The medial femoral epicondyle, the lateral femoral condyle, and the fibular head. Okay, let's see if this allows more room. Okay. For the soft tissue palpation, there's a lot more, but you go ahead and you start with the quadriceps as a group. Okay. And then you do them individually. So the vastus, the vastus lateralis, okay, the vastus medialis, the vastus intermedius, which you need to do a tissue pull to actually access, and then the rectus femoris. You have to move out of the way to get to the vastus intermedius. Then you do the infrapatellar tendon. Okay, you do the bursa, you do the prepatellar, and the superficial infrapatellar. For the medial meniscus, you have to externally rotate. For the lateral meniscus, this is a horrible view, I'm so sorry. You have to internally rotate for the lateral meniscus. Then you have to do the popliteal fossa with both fingers. Then you have to do the lateral collateral ligament and the medial collateral ligament. And don't forget about the gastrocnemius muscle. Oh, and then you have to do the gracilis, the semitendinosus, and the sartorius. So it's inferior to lateral. So the semimembranosus is most inferior. And then it would be the gracilis and then the sartorius. And for active and passive range of motion, so for flexion, it should be about 135 degrees. For extension, you should be able to get it to 0. And then internal and external rotation, there's really not much. The tests for this case, because we are looking for a MCL or an ACL tear or sprain, we will be doing McMurray's test, the MCL test, the LCL test, and the drawer sign. So for McMurray's test, you are going to have it about here. What you're trying to do in this test is reproduce the click. So you come here and then bring it down into extension, and then you do this way and bring it down to extension. A positive would be hearing for that click, and it can also be palpable. It can indicate a tear of the medial meniscus on external rotation and on internal rotation of the lateral meniscus. The MCL and the LCL, I will also do Lachman's test. So let's start with Lachman's test. You have it at about 30 degrees. It's a little over 30 degrees. Oh, I'm having a blank. Push. Why am I having a blank? Let's just do drawer sign because I really can't think right now, honestly. I'm about to give up. So you are pushing, yeah, you're pulling here, feeling for any gaping. Anything greater than 6 millimeters of gaping would indicate, if the leg is pulled, would indicate the tibia moves anterior. Push would be inferior. For Lachman's test, that's 30 degrees. And you pull, and then you push. Okay. For the push, that's touching the ACL. No, for the pull, that's touching the ACL. For the push, it's the PCL. Lachman's, drawers, lateral, collateral. Lateral, collateral is tested similarly. So you are pushing and pulling. If there's any gaping or pain, it indicates a tear or instability. And then that was it. You can also do the bounce home test. That's also normally done during like palpation. And it can indicate swelling of the knee or an accumulation of fluid. Like I said, in this case, we're looking for an MCL or an ACL, thinking maybe medial meniscus also. There tends to be less swelling in that area. Thank you. I appreciate you.